Hello, Dr. Kanodia.
Hi, good evening.
Thank you so much for doing this interview for us with the RHINOPLASTY Network.
It's my pleasure.
You have over 28 years of experience performing thousands of operations and nose jobs. Would you say that it's gotten easier for you as the years have progressed?
I don't think I could ever say that rhinoplasty has become easier. You have a lot more knowledge, surgical experience, and yes, it's very important, but every nose is a challenge in the sense that you have to meet the artistic challenges. And when you're performing a rhinoplasty, it's all about little millimeters, half a millimeter, quarter millimeter, millimeter here, millimeter there. So there are a lot of ambivalences during surgery. Should I take out another sliver? Should I file this down a little bit more? It's like a painter when he says, do I need one more bird here? Do I need a little bit more green in this tree? So I have to design the nose, and my two main points are it has to look like it was never touched, it has never been touched, and create the necessary enhancements this nose needs for this face. Each nose presents a challenge. So I want to deliver a nose which is going to function better than ever before, and then I want them to like it, enjoy it, grow into it for the rest of their life.
So how important do you think it is for a patient to go to the right doctor for the first time?
The choice of right doctor is probably the most critical element, and more so in noses than anywhere else. Gallbladder, you can go to 3 doctors and, all 3 of them can take out the gallbladder in a very nice way. When it comes to noses, I think it's the most critical because it's the sense of design the doctor has. To give you an example, I think there were a couple of times when Monet and Renoir went and painted side by side a bridge, and they're so different. And so the patient has to choose the doctor where they feel that they can accomplish what they're seeking.
On the other side of that, when you're meeting your patients and you're for the first time and they're talking to you about their needs, are there patients that you ever turn away?
I turn away, I think, 2 or 3 times more patients than I accept. One category, they don't need it. There's a perfect balance. They don't like a little bump. I said, no, I like the bump. That bump is the perfection in your face, so we should not touch it. Yet my hands are itching to create that little thing, but yet still, there are a lot of imperfections I like. So I said, no, you don't need it, and we shouldn't do it. Let's close the book. Then there are patients who have very unrealistic expectations. They think that just because they're getting their nose done, they're going to look like, Ashley Simpson, or they're going to look like Cindy Crawford and Angelina Jolie. And strangely enough, they will bring pictures and they'll say, can I look like this, And I said, no, you will look like yourself, just improved, enhanced version of wherever we think that the enhancement is needed. So if you show me a picture of a model, if you show me a picture of, somebody you like, it's not possible. It's not possible to take a nose and transfer it into Cindy Crawford nose or Angelina Jolie nose. You can't do that. It just doesn't work.
And I have to ask, I know you probably won't be able to answer, but there are all sorts of rumors about patients that you've had and references to celebrities that you've worked with. So specifically Ashley Simpson and also Jennifer Aniston and Cameron Diaz. Is there any way that you can comment on any of those?
No, that's one thing we cannot. It's amazing when you look at the movies, you look at magazines, you see this beautiful face and it says hair by Orbay. There's no such thing as nose by Raj Kanodia. So I wish there was a day when a lot of these pictures I look at in magazines, and even after the movies, if I get credit, nose by, lighting by so-and-so, nose by Kanodia. It'll be great, but no. The reality is we have a doctor-patient confidentiality, and me as a doctor, I cannot reveal.
You've been working, as we mentioned, for over 20 years, and you travel around the world doing speeches and conferences and surgeries. Tell me a little bit about your beginnings and where you're from and your journey.
The journey started in Calcutta, India. I was born and raised there. I was fascinated with beauty as far as back as I remember. And earlier on, like at about 10 or 12 years of age, was a little story I can tell you quickly. A doctor had made house call to my house. My mother was a little sick, and my dad was so respectful to this doctor that I was just blown away. Why is my dad so respectful to this man more than anybody else I've ever seen him interact with? So that was the moment when I said, I want to be a doctor. If my dad respects a profession to that degree, I want to gain my dad's respect. I think that was a subconscious or the conscious decision. That day on, I told myself that I want to be a doctor. And combine that with my passion for beauty, you become a doctor, and then you become a plastic surgeon. So my journey started in Calcutta, then I went to Chicago, did all my postgraduate schooling in Chicago. And then I was very fortunate and blessed that Dr. Parks, who's my mentor, probably the biggest name in rhinoplasty in that period. I'm talking back 60s and 70s. And so I met him in 1979, and he accepted me as his fellow through the American Academy of Facial Plastic Surgery to be a fellow. So I worked under Dr. Parks. First year of fellowship is over, and he says, I don't want to train anymore. Could you be my fellow for the next 3 or 4 years, help me, assist me, and learn from me, and build your own practice?
We know that you accept revision work on a case-by-case basis. Can you tell me a little bit about when you will do that for a patient?
Revision rhinoplasty could be, in my opinion, could be classified into 2 or 3 different categories. One is that the nose has been butchered or traumatized to such an extent surgically, or that it needs reconstruction. It needs a rib, it needs a ear cartilage, or it needs a piece of bone. That's serious reconstruction. And I think that in itself is a specialty. And that's not me. It's very time consuming, and you're borrowing a rib or ear cartilage, and so it's 6-7 hour surgery, and it's not finesse rhinoplasty. I like to do finesse. I like to take beautiful, beautiful faces and finesse it. So it's very challenging, and sometimes I'm not able to meet the challenge. I'm not thrilled. When I'm done, I go, And putting myself in the patient's shoes, she's had, or he has had 2 or 3 or 4 surgeries. They're entitled to a beautiful nose, and that's what they're expecting. And I'm not able to deliver that perfect nose, which I would like to. So it's frustrating as an artist, sculptor. It's frustrating that I cannot deliver what I want to. What I want to sculpt, I cannot accomplish because of the anatomical limitations. And so I would say that the reconstructed revisional rhinoplasty is not my forte.
Your primary location is Beverly Hills. You mentioned the Camden location. Do you do any work outside of Beverly Hills? Any surgery or injections?
Surgeries I do in conferences. I just did one in India a couple of months ago. I've done one in UK, and surgeries I would prefer to do it at my center. It's difficult to take the whole team, and you need the whole team to get the best result. So, but injections, yes, you can, because it does not need X amount of instruments and a paraphernalia. So injections you can do, and we do go to New York to take care of the patients.